name's Kester from Active Health Clinic, and I thought I'd just put a quick video to chat about the use of exercise sort of in the earlier stages of managing an invisible illness. So when I say invisible illness, I'm talking about chronic fatigue syndrome, or ME/CFS, pain sensitization conditions like fibromyalgia, and OI and POTS. So essentially, in these conditions, we know that they are triggered due to allostatic overload, so an excessive stress on the nervous system. And in response to that, people often have a quite severe intolerance to exercise and other types of exertion as well, but today we're talking about exercise. And when there is that intolerance to exercise, people find that in response to exercise, especially exercise that is above their threshold, and that threshold has been reduced due to sensitization, they experience post-exertional malaise, so their symptoms get worse. Graded exercise done right can be a really powerful tool in managing these conditions and improving your tolerance to exertion, especially physical tolerance. But we obviously need to do that in a safe way. So in the beginning, basically we're just looking at finding a dose of exercise, and this usually will be quite small, and if someone has had nervous system sensitization, chronic fatigue triggered later in life, they'll find that their exercise tolerance has dropped quite significantly, and so it's just about finding a level of exercise that isn't going to cause that post-exertional malaise, and it often, for a lot of people, is a very small amount of exercise, and the amount of exercise isn't actually going to promote muscle strength or improve cardiovascular fitness. But basically, in this context of helping with invisible illnesses, we're using exercise to start to kind of desensitize the nervous system to that dose. So we're finding that level that is sustainable, that someone can do ideally every single day, or at least on most days, being consistent with that. And over time, by finding that dose, being consistent with it, the nervous system gets really good at tolerating that. It isn't seeing it as a threat anymore. It's not having that inappropriate response where the symptoms flare up in response to that. And then over time, once people are consistent, then we can start to slowly increase that level, whether that's from 5 minutes of walking for 2 weeks, and then to 7 minutes for another 2 weeks, and then to 10, and so on. That's just an example. It might look different for different people, but essentially in those earlier stages, we're using exercise to desensitize, to communicate safety to your nervous system, as opposed to building strength or improving endurance, anything like that. So it's just important to have those expectations and awareness of what the goals are in those earlier stages. But yeah, thanks for watching.